We're live from the State Health Operations Center in Smyrna, Delaware. And this morning we're joined by Dr. Karyl Rattay, the Director of the Division of Public Health, by Dava Newnam, the Director of the Division of Services for Aging and Adults with Physical Disabilities, and Ken Bock, the CEO of the Cheer Center in Georgetown. Good morning.
Good morning.
Good morning. Good morning, everyone. So a lot has evolved since we were last together last Wednesday morning. We now, as of late yesterday, had 319 cases in Delaware and sadly 10 deaths in our state. We are seeing COVID-19 infections throughout our state. If you go to our website, you can see a map that pretty much shows you the entire state of Delaware is touched. Since we last were together for our Facebook Live last Wednesday, we've seen an increase of cases 260%, which is really the same as more than doubling every 3 days, which is what you expect to see when you have widespread infection. So we certainly know we are in the midst of what's called the acceleration phase of this. And again, not unexpected, but very concerning. There are sadly 10 individuals in our state who have lost their lives. All of those individuals are over age of 65 and all with chronic underlying conditions. Half of those cases are associated with long-term care facilities. So I want to touch on a few key points. One is around long-term care because we have been getting a lot of questions about that, and I'm really happy that Dava is here and that Ken is here as well. Certainly that is a key aspect of our focus in working with long-term care sites across the state to ensure that they're doing everything they can to maximize prevention activities to prevent infection, to prevent hospitalization and death across their facilities. And so we're grateful for that partnership, and we certainly hope that that and many other efforts around long-term care can make a big difference. But that being said, what I will tell you, some of the things that we keep seeing over and over in our cases is that people are not being compliant with a lot of the guidance that is given. People are going out, people are going to work when they are ill. And yes, we appreciate that many people who are working for essential services, including healthcare providers, going out and doing the work right now. But anyone, no matter who you are, no matter what your work site is, if you have any symptoms, and I'll talk about that in a minute, any symptoms of illness, please, please, please do not go to work. Please don't go to the supermarket, to the pharmacy. Please get somebody else to do that for you. We are especially concerned about individuals who are at higher risk, and so I'm really glad we're going to spend more time on individuals over the age of 60 and individuals with chronic underlying conditions. And the reality is that the older you are or the sicker you are, the more likely you are to succumb to this illness. I keep hearing stories about individuals who are in their 70s, 80s, getting together for parties. And the reality is then we're seeing people succumbing to illness after those events together. And I think it's so important that we all have the belief that we're all carrying this virus, and that coming close to anybody is we're putting others at risk for illness and for death. And so we can't have parties with one another. We must abide by social distancing. We must stay home as much as possible, and we must protect those who are at the highest risk. The governor and the Division of Public Health are extremely concerned that many businesses are not being compliant with social distancing. And we want to say that we intend to crack down on this. Some businesses are doing a great job of keeping people who, of keeping people who are ill out of their facilities, and also keeping people social distance in those facilities. But if we find businesses that are not being compliant, we want to know about it. If you are aware of businesses where social distancing is not occurring, please send an email to dphcall@delaware.gov. We want to know. We also want to know if there are positive cases who are not staying home and not being compliant with their isolation requirements. Please let us know, dphcall@delaware.gov. With that, I'm going to hand it back to you, Jeff.
Great, thank you. So today we want to focus on some of the issues facing the seniors in our community. Obviously, this is of great concern as we've heard some of the statistics that they can be at greater risk of having serious complications from COVID-19. Ken and Dava, do you have any kind of thoughts about how your organizations are coping and some of the things that you're doing to help seniors in the community?
Yes, absolutely, and thank you, Dr. Rattay, for having us here today to talk about these issues. This crisis is affecting everyone, but particularly those that are more vulnerable: seniors, those over the age of 60, those living with physical disabilities, or those with underlying conditions. It is imperative that all of those individuals strictly adhere to the Center for Disease Control and Prevention's suggestions about staying home. If you have to go to the grocery store, we're very thankful for our grocery stores and our pharmacies and our retail community for really stepping up and opening early so that these individuals have the ability to go and get what they absolutely need without having to deal with a lot of crowds. So we encourage you, if you must, go to the grocery store or pharmacy yourself to go during those times. We would ask you to contact your friends, your neighbors, your family members, and ask them to go for you, and to leave those items outside your door so that you don't come into direct contact. If you're unable to do that, to get to the store yourself, or to use your community, please reach out to the Aging and Disability Resource Center at 1-800-223-9074 or DelawareADRC.com for help. That is a 24/7 line, and we will work through those issues with you. Now more than ever, the Meals on Wheels program is being utilized to make sure that seniors and vulnerable people are still getting the nutrition they need in the community, which is going to keep them healthy overall. Our meal count has increased in the past just 30 days by over 50%, and we continue to see that increase as the need arises. So if you know someone who you think or you yourself could benefit from a home delivered meal, please contact the ADRC. Again, 1-800-223-9074. We encourage everyone to stay home, stay safe, and if you need help, call us. Ken, do you want to talk about what's going on in Sussex County?
Certainly, and I want to thank the state for this opportunity to get the word out and for their leadership and support to the service providers in the communities. In the case of CHEER, we operate multiple senior centers throughout Sussex County. Consistent with the governor's executive order, all of those sites have been closed. People who depend on coming in there daily for meals are no longer going to be able to get together in those congregate settings. So we have changed our program, and we're now providing a grab and go kind of service where seniors that have the ability to drive to the center location, they can wait in their car and have curbside delivery by volunteers bringing the meals out to them. Additionally, and David had indicated, there's an increase in the numbers of meals being served in the Meals on Wheels home delivered meal program. We're seeing a huge growth in that program, and we have been working over the last 2 weeks to try and not only serve those additional people coming into the program and those people who can't come into the senior center but still rely on us for meals, to make sure they're getting their meals in their homes, but we have also ramped up our production capabilities to produce additional frozen meals, and we have gotten in additional and assembled shelf-stable meals so that we are able to provide up to 15 additional meals in the homes of each of these seniors, so that if supply lines get impacted or our ability to deliver gets impacted as we go through this pandemic, the people will have food in their home. They won't be isolated without access to that nutrition. And I would like to particularly recognize the volunteers who are so critical to what we're doing in this homebound meal delivery program. These are people, many of them seniors themselves, that are going throughout the community, adhering to changed protocols to try and protect their safety, but they're still out there delivering these meals to seniors. But instead of the direct face-to-face contact that we've had, now meals are delivered in plastic bags that are hung on doorknobs. Volunteers knock on the door, ring the bell, and then they step back, that's social distancing 6 feet, to allow the person to answer the door and take that meal in. So we're providing personal protective equipment. We're trying to do the things we can to keep everybody, our volunteers and our customers and our staff, as safe as possible, and still ensure that those seniors are going to be able to have what they need to sustain themselves in their homes.
Dr. Rattay, we know that seniors are a high-risk group for COVID-19, but we know that all age ranges are being affected by it. Can you describe why seniors may be more at risk? Is it something to do with underlying conditions because of the age? Can you just go into some details?
Yeah, so, I think I say this every time that we're learning every day more about COVID-19. There was a study that was just released a couple days ago that really shows that those, especially with diabetes, any type of lung disease like COPD, and those with cardiovascular disease are especially at higher risk. And of course, anyone immunocompromised, so for example, somebody who's receiving cancer treatment also is at very high risk. Now, this actually isn't a change from what we saw from China, but it's really reinforced by the Delaware, by the data that we're seeing in the US. But I think one thing that's really interesting is another study that was just released from the nursing home in Washington State that I think we all sadly watched the experience. And many people were found to be, by laboratory testing, positive in that nursing home from a recent test. What they also found was about 50% of those positive cases were individuals who actually had no symptoms, which was quite a surprise. So although many individuals did very poorly who became infected, there were also a number of individuals in that long-term care site who had no symptoms. And that again reinforces for us the incredibly important message that we all have to act as though we have the virus. And that seems to be especially the case for seniors as well as children, that even though they may not have symptoms, they certainly could have the virus and can spread it. So we all have to keep that distance from others.
Dava, the Department of Health and Social Services manages a few senior facilities. Can you kind of talk about some of the additional procedures that have been put in place to help protect both staff and residents?
Sure. So the guidance to long-term care facilities is to cease and desist any outside visitors. The only exception is in an end-of-life situation. All communal dining has been suspended. All activities in a communal setting have been suspended and are occurring on a one-on-one basis. And most importantly, all staff or people coming into the facility are being screened per the CDC guidelines.
That's great. And Ken, can you talk about if people have questions about how to get your resources? Do you have access to a website or some place that they can get more information?
Absolutely. We're trying to keep our website, cheerde.com, updated regularly with service changes that are impacting what we're doing out in the community. In addition, people can always call us at 302-515-3040. There is always going to be a live answer person on that line here that can try, and if we can't answer it directly, we can make the appropriate referrals. Dave had talked about the state resources through the ADRC, and we work with a number of other groups, and we are in constant contact with other community service organizations and the state throughout this pandemic period. So as a point of entry, so to speak, if you have questions and need to get assistance, you can call us at that local number in Georgetown. And if we can't provide the assistance directly, we can certainly get you in touch with and coordinate with the people that can.
Dr. Rattay, we had a question about somebody that's in their 70s. If they want to grocery shop with their spouse during the special senior hours, what are some ways that they can make sure that they're safe during that time?
Yeah, great question. First of all, I'm going to emphasize this again. If either individual has any symptoms at all of illness, and I said I'd talk about that, so bear with me for a moment. Now we're saying symptoms of illness are not just fever, cough, or shortness of breath, but whether an individual has body aches or has had body aches in the previous day or so, sore throat, runny nose, even stomach pain and diarrhea are symptoms that we're seeing with cases. So any signs of illness, please don't go. When you do go, practice really good hand hygiene. If you can, wash your hands before you go, but also keep some hand sanitizer. Take hand sanitizer with you. Use it several times throughout your trip. Make sure you stay 6 feet away from any other individuals through the store. And the second you leave that store, clean your hands again with hand sanitizer and wash your hands well when you get home. And then be very careful not to touch your face during that time until you've done like a great hand washing once you've gotten home. If you follow those things, it should help quite a lot.
Any final thoughts that you want to give to the public for you, Ken, or Dava? Any final thoughts for today?
I really want to thank Dava and Ken for the work you're doing to support our vulnerable populations, important members of our community. And I also want to make sure that folks know that we've got our call center, 866-408-1899, as well as our email address, dphcall@delaware.gov. And we're continuing to put information, including numbers of cases and the maps and different information up on delaware.gov/coronavirus. Thank you.
I'd just like to say that we're also really concerned with seniors being told to stay home with isolation and depression. So I would encourage you to call your family members, call your grandparents, call your friends, call your neighbors, all you kids that are stuck home. When you're caught up on Schoology, call your grandparents, draw pictures. If you don't have a grandparents that you can call or draw pictures, you send them to the nursing homes, because these are tough times for these individuals that aren't having any contact with the outside world. So please do what you can to touch base with them by phone, video chat, or even letters.
And I would say if you are a senior isolated in your home right now, there are resources out there if you need something. Not just if you're not feeling well or feeling symptoms that could possibly be of disease, but if you need food, if you need other kinds of necessary support in your home, get on the phone, reach out, or go online. There are resources available. Don't sit home and let a bad situation continue to devolve.
Great. Thank you very much for your time, Dr. Rattay, Ken, and Dava from the State Health Operations Center in Smyrna.